Assalamu alaikum. So, how many are psychiatrists here? Anybody? Oh, there are one? Oh, so I'm not alone. And so the rest of you are, I guess, family practitioners. Is that right? Very good. You're very important people, and I'll tell you in a second why is that, especially for psychiatrists. So, as you can see, 50 to 70% of all psychiatric patients are treated by family medicine. So all of our patients, they come to you, and we usually, this is worldwide, this is not just in Pakistan, but everywhere in US, all psychiatric patients are managed by family practitioner. So that's why it's very important to understand what psychiatry is and to help the patients. So what do I do next? I forgot.
This one.
Okay.
Like this.
This goes down?
This one. Yeah. This one.
Okay, thank you. So why you guys are important? In Canada, a few years ago, they found out somehow, I don't know how, but one psychiatrist is needed for 10,000 people. USA said, that's right, so they followed that. In Pakistan, there was a study, and this was, I couldn't find out more data, but my other psychiatrist might help me. Pakistan, there's 0.19 psychiatrists in 100,000 people. So that's why you guys are very important. So the number of psychiatrists in USA is 45,000 to 50,000, and the population there is 335 million people. So I again could not get any data more than 400 and 500 psychiatrists, and we have a population of more than 245 million. So that's why, again, you guys are so important, because there will be some patients you will see first and follow them throughout their course of illness. So that's why you were very, very important. So let's talk about some, how these psychiatric problems emerge or develop in life. So what they have seen is childhood abuse, and this abuse can be physical abuse, emotional abuse, or even sexual abuse. So it can have anything. And same goes with trauma. Trauma not only contains, all those abuses, but it also entails like, even a simple surgery. If a 40-year-old has hypospadias and they go through 6 surgeries, 6 different years, 6 different times, they go through trauma. So that can cause depression, anxiety, and you might have seen people who are scared of seeing their doctors, their nurses, just because they have seen them in such a bad way. They were in pain, and they met the providers. Then neglect. When a kid is neglected, certainly they're bound to have some psychiatric problems, and that must be taken into account. Social isolation, loneliness. If somebody is just put in their room and not let other people come talk to them, just keep them away. And I'll give you an example of this. In fact, I know somebody whose son has some developmental delay. So the mother is a doctor. So she has started isolating herself and isolating the kid because of the taboo, the stigma that comes with it. So she has isolated the kid. The kid doesn't know How many uncles does he have? How many aunts? They don't go even for Eid to anybody's house. Nobody comes to their house. So imagine what would be the situation there. So that's that. Then we come with discrimination. If a person has some kind of discrimination through their life or early in the childhood, certainly they become more prone to having psychiatric problems. So the example here would be, if a person is called fat, tum to mote ho, from earlier on, tum to bilkul ladki jaise ho, tum ladke jaise ho, they carry this all through their life. तुम्हें हिसाब नहीं आता, तुम्हें अंग्रेजी नहीं आती, and you keep on repeating, this goes and stays somewhere, and then you come up with some psychiatric problem. Then the stigma. Stigma is bad name. You know, you give them, like I just told you, tum to mote ho, tum ladki ho, tum ladke ho. This carries on all through their lives. So we should not be labeling people like that. What are some of the risk factors? So there is genetic predisposition, and genetic predisposition means some kind of genes. So there are some disorders in psychiatry which are very related to some genetic predisposition. Like, for example, depression. Their family, there could be a gene that has, that is a depression gene, and it carries on to the family. So we got to be aware of, I'm not against, the cousin's marriage, but we got to think about it. There comes the genetic predisposition. Family conflict. If mom and dad are fighting, obviously there will be some effect on the kids. If mother and nani or dadi are fighting, certainly there will be some risk factors. If the dad is fighting, there will be risk factors. And we have extended family systems in some areas. So if anybody is fighting, who gets the brunt? The kid gets the brunt, and they get the dose. Then we have stressful life situation, like unemployment, very, very common. People have to feed their kids. Where do they bring the money? They end up into corruption, they end up into stealing, criminal activities, or they don't have time. So you got to be careful there. Homelessness, people don't have homes. They go on the streets, and this is what they get. Unemployment, financial, we've talked a little bit. Drug abuse, which is becoming very common. I left for USA in 1983, and during that time there was zero drugs problems. Very little alcohol in upper society. People could not afford it. Now, my God, you see, a lot of people with drug problems, and not just one drug. You have multiple drugs, and then they're coming up. Again, there are some companies, not the pharmaceutical companies. I'm not going to talk about that, but there are other people who get benefits. They make some medications like synthetic marijuana. K2 is another one. And nobody knows what to do with this. Patient, 19-year-olds, they come in, they having seizures, and you don't know what to do with them. They can't speak. Family, mom and dad are not there. You just deal with the patient. Then there are so many other stories I can tell you about the drug abuse. So, why it is challenging, more challenging in Pakistan. It's very, very challenging everywhere, but more so in Pakistan. We have a number of health professionals. very, very few health professionals available. So 90% of the people, they leave, they're untreated. And here we have the danger of getting the fog, you know, the khankas. You know, where do the people take their patients? We don't have treaters, so they go into folk treaters. They get help from there. So that's why, again, very, very important, you got to fill in that gap. Drug abuse, we just talked about. Family cultural and religious barriers. A lot of time, we end up in this situation. We want to treat a person, and, you know, by the way, I'm going to give you a little story here. I have started a free camp to see psychiatric patient in Lahore. So it was two weeks ago, and I'm going to be here till the 17th, another week next week. So I was so impressed to see the patients who were coming, very, very educated. They want to get treated, but there are barriers. Obviously, there are barriers. And one of the barriers is their mom and dad. They don't want them to be treated. First, obviously, for several reasons. For their religious beliefs, for their family beliefs, for their culture, for the stigma. They don't want to deal with it. People want, and it's expensive, obviously, and it's chronic. Mental health is like blood pressure, diabetes, heart disease. It is chronic all through the life, and it's expensive. No medical treater, we just talked about. Financial, obviously, things are expensive. People need to know if they can afford food or they can take medication. So there's a drawback there. And our priorities, we just talked about it. Food versus the cost of the medication and the stigma, the other things. So when you're seeing a mental health patient, I would like you to think about these, because your patients will not come and tell you they have a mental illness. I am depressed, I am anxious, I have schizophrenia. They will not tell you that because of so many reasons we have just described. So think about, if somebody tells you, I'm worried, you need to start asking questions. I feel unhappy. How many people have seen patients saying, I'm worried? Can you raise your hand, please? Just 2 people? Every patient that I've seen, they come and tell me they're worried. They come with a worry. And we miss it. We miss the patient. So we need to think about that. A person, usko leke aate hain कि जी हर वक्त बक-बक करता रहता है, चीजें फेंकता है. Talk to them about why they're doing it. You can get so many clues. कि जी सोता नहीं है, insomnia. सोता नहीं है, सारी रात जागता है और गालियां देता है. Talk to him why that is happening, rather than just thinking about, oh, cardiovascular. Yeah, you need to think about that too. Or pain in the legs or respiratory, whatever, but you need to start thinking about other things too. कि जी खाता नहीं है, भूख मर गई हार्ट अटैक के बाद. It could be depression, very, very common. After acute myocardial infarction, the risk of depression goes up. And there is a study that there are people who die within a month's time after an AMI is 2 times more who have depression than who don't have depression. So think about that. Then, कि जी ये किसी से बात नहीं करता, चुप होके बैठ गया जी, सब कुछ हो रहा था, कि जी ना मिलता है, ना कोई खुशी होती है, ये बैठा है. These are your clues to talk about things. Drug abuse. They will not tell, but you have to ask them. Guilt, ये जी बहुत ही परेशान है कि इसने कोई काम किया था 100 3 minutes or 0 minutes. Oh, I'm sorry, I'll just rush up. So, if you have a psychiatric patient, don't get afraid, don't get anxious, respect your patients. अगर आपने उनसे गलत कलामी की, भाग जाएंगे, वो नहीं आएंगे दोबारा. So you have to respect them. Non-judgmental speech. आपने ये नहीं कहना तुम इतने बुरे हो. एक ने आके कहा, ये जी मेरा बेटा है, पागल है बचपन से. अब मैं उसको देख रहा हूँ, मैं अगर कहूँ हाँ भाई तू पागल है, वो मेरे पास कभी नहीं आएगा, किसी के पास नहीं आएगा. So you got to be careful. Always interview families, but don't take that very, very seriously. Yes, you have to find out what is going on. कुछ families लेके आती हैं जी ये मेरा husband ख़राब है जी, ये जी बीवी ख़राब है, मगर उनके intentions कुछ और हैं. So you have to clean that up. जी बस ये. So there are, what are some psychiatric emergencies? If a person is suicidal, homicidal, किसी और को मारने, आपसे बता रहा है कि जी मैं जाऊंगा और जाके मैं इसको मार दूंगा. You have to go do something. कोई acutely psychotic है कि मुझे आवाज आ रही है कि मैं इसको मार दूं. You have to take care. Multi-drug abuse. So इनको सबको हॉस्पिटल भेजें, सबको भेजें. कौन सी ट्रीटमेंट्स होती हैं? मूड डिसऑर्डर, एंजाइटी डिसऑर्डर, psychosis, substance abuse. DSM, very important. DSM is a book that we have to diagnose patients. The current edition is 5TR. It's a very thick book. In America, it's called the Bible of Psychiatry. So it's like Quran Sharif jitni badi hoti hai, magar this is what they call. Time criteria, har illness ka time criteria hai. कि टाइम है उसके अंदर, उससे आपने इससे हिसाब लगाना है. सिम्टम क्राइटेरिया, 2 things needed. एक डिप्रेशन है, 15 दिन मेजर डिप्रेशन, 15 दिन वो डिप्रेस रहे, फिर आप डायग्नोज करेंगे. इससे कम होगा तो नहीं करेंगे. स्किज़ोफ्रेनिया 6 महीने उसके एक्टिव सिम्टम्स हो तो आपने करना, नहीं तो नहीं करना, कुछ और करना है. सो यू हैव टू बी केयरफुल. जल्दी कर रहा हूँ. Avoid unnecessary testing. I have seen a person with OCD, obsessive compulsive disorder. I was in Hyderabad, Sindh. वो लेके आया मेरे पास रिपोर्टें, X-ray skull. I don't know what they were trying to find out. Sperm count. I don't know what they were trying to find out. So please don't do unnecessary tests. We don't have too many tests. We have very few. Thyroid, बिल्कुल डिप्रेशन जैसे होते हैं. विटामिन डी वेरी इंपॉर्टेंट फॉर लाहौर. अभी मैंने 3-4 केसेस देखे हैं लास्ट वीक. फॉग, नो सन, डिप्रेशन, एंड वी कॉल दिस सीजनल अफेक्टिव डिसऑर्डर, सैड, SAD. तो सर्दियों में होता है जब सूरज ना हो, विटामिन डी नहीं मिलता. लेवल चेक कराएं, विटामिन डी दें, एंटी डिप्रेसेंट ना दें. टेस्ट फॉर सर्टन साइकोट्रोपिक मेडिकेशन, कुछ मेड्स हैं जिनकी आपने करनी है. डेपोकोट, एंटीसाइकोटिक्स, उनको आपने चेक करनी है. लैब्स, हीमोग्लोबिन A1C, कोलेस्ट्रॉल, वो ख्याल करें. ट्रीटमेंट्स, वी हैव साइकोट्रोपिक मेडिसिन, एंटी डिप्रेसेंट्स, एंटीसाइकोटिक्स. ये लिस्ट है सबकी जो हम देते हैं. और यू नो, व्हेन आई वेंट to US, there were very few treatments available. Now, alhamdulillah, we have tons of treatments and therapies. So please make best use of these. Last slide. When to refer a patient to a psychiatrist? Dr. Sahab, aapke paas. Any psychiatric emergency that we talked about, suicidal, homicidal, acutely psychotic, drug abuse, send to Dr. Sahab. Unsure, if you are unsure regarding diagnosis, send there. If you are unsure what you're treating, send them there. If you have your own uncontrollable emotions, एक LGBT जो अब नई चीज़ है यहाँ, वो आके आपके पास बैठ गया, यू आर नॉट ट्रीटिंग LGBT, you are treating the patient who has diagnosis, anxiety, who has depression. You treat that, please. जो बाकी चीज़ है वो उसको जाने, अल्लाह जाने. और कोई चीज़ हो ऐसी, ड्रग अब्यूज़, you treat the patient. चरसी, भंगी, ये मत कहें उसे. So thank you very much. This is it.